My name is Srđan Mrkić. I am the Chief of Demographic Statistics in the United Nations Statistics Division here in New York. And I would like to take this opportunity to welcome all of you to the side event on the UN Legal Identity Agenda. This side event is organized in parallel with the regular annual meeting of the United Nations Statistical Commission. And in the normal circumstances, you certainly would have this side event taking place during the week of the Commission. Unfortunately, and because of the current pandemic circumstances in most of the world, we will have this side event online, and we expect essentially to have the same setup as we did have, as if we would have it in normal circumstances. Allow me to just go through the proposed work program for this side event. We will have an introduction on the UN Legal Identity Agenda work that has been done by the United Nations Legal Identity Agenda Task Force in the past year, and that has been the work that has been quite intensive, and we will be reporting on the outcomes. So we will have the three co-chairs providing some more detailed information regarding different areas and aspects of the work that took place in the past year. And we will be hearing from UN Statistics Division, DESA, Unicef, and UNDP. Then we will turn to the impact of COVID-19 on the civil registration and the production of vital statistics, one of the major components of the United Nations Legal Identity Agenda. And that will provide an overview of what we are documenting is happening worldwide when it comes to the universal registration of vital events. And that has a direct impact on the quality and the comprehensiveness of resulting vital statistics. It is certainly one of the aspects that we would like to emphasize as being critical in terms of many different areas regarding the proper assessment of the consequences of the pandemic worldwide. Then we will also provide an update on the estimated completeness of births and deaths according to the data that we are collecting here at the UN Statistics Division. We will then hear a very concrete presentation from our colleagues UNECA that were leading the effort of implementing the UN Legal Identity Agenda in Africa, in the pilot countries in Africa, and this will be reporting on those on that work that took place there. Also, very important component of the UN Legal Identity Agenda is the availability of legal identity, and especially from the point of view of global cross-border mobility. And we will hear from our colleagues from IOM about the issues that are very pertinent for this theme. And then, of course, without the participation of the country, both on the donors side and on the implementation side, it would be very difficult to promote the UN Legal Identity Agenda, almost impossible, rather, as an ultimate goal to be reached by 2030. So in that respect, we are really very glad to have the opportunity to hear from the Permanent Mission of Japan here at the United Nations in New York, and from Kenya, from the Bureau of National Statistics of Kenya. So this is the plan, the program of work for this morning here in New York. And I know, of course, that the time difference is affecting many of you, and we appreciate your presence here. And without further ado, allow me to then proceed with the first segment of the program, which is the introduction to the UN Legal Identity Agenda and Report or Work Program for 2021. We will not be having presentations here. We will have just the oral presentation of the UN legal identity agenda from the normative point of view, from the point of view of supporting the pilot countries and presenting the work program for 2021. So by way of starting the conversation, allow me to outline that the UN legal identity agenda, which is a holistic approach to civil registration, vital statistics and identity management, has been formally adopted together with the operational definition of legal identity by the United Nations Statistical Commission during the 51st session that took place in March last year. It was further ascertained by the ECOSOC, which is one of the 5 major bodies of the United Nations, by its resolution that was adopted by ECOSOC in June 2020. By this, we mean that essentially at this point of time, the UN legal identity agenda, as presented in those documents, which is a system of different components that ensures universal registration of all vital events, translated into comprehensive, reliable, accurate, and regular vital statistics, and ultimately resulting in a legal identity for all from birth to death. And this is the system that encompasses the informants, which are the health institutions and the health sector of the countries, the civil registration system, the national statistical system, then the population registers and national identity management systems in a coherent, interoperable manner that essentially ensures, again, the universal registration, the ultimate goal, universal registration of all births and deaths and marriages and divorces in the country, and translated into regular vital statistics that are critical for understanding the distribution and the dynamics of a population of a country, as well as ensuring the legal identity for all from birth to death. So this is the system that has been put in the methodological framework that has been adopted by intergovernmental bodies, by the United Nations, and this is now the agenda that has been distributed to all the United Nations country teams in countries, thus ensuring that the implementation of this model is an utmost priority in all of the countries. We will see later on in our presentations the state of the art in terms of the completeness of civil registration worldwide, and that will certainly be another argument why this agenda is so important and is so critical in terms of the implementation. Also, we need to outline the fact that one of the SDG goals, 16.9, the legal identity for all, is achievable. It is achievable within the time frame given by the agenda, which is by 2030, if we implement the UN legal identity agenda model immediately and start improving those systems and linking them in an interoperable manner. In order to make sure that the countries have a full set of advice that they need and support that they need in implementing and building the model as per the agenda, we did build a methodological framework. So the cornerstone of the methodological framework for it are the principles and recommendations for a vital statistics system that were issued in 2015. They provide the international standard for the functioning of the civil registration that is translated into vital statistics. Essentially, the vital statistics system is defined as an interoperable whole of registering vital events and then reporting to the statistics for the production of vital statistics. The second piece of the methodological framework is the Handbook on Civil Registration and Vital Statistics Systems, Management, Operation and Maintenance, Revision 1, that was issued in 2018. This provides a much more hands-on advice and examples from countries that implemented fully the UN legal identity agenda and are ensuring a full interoperability between the registration and vital statistics and identity management. It provides the different instruments that the countries may find appropriate to use in their national circumstances, and to adapt some of these models to their own national circumstances. The third piece of the methodological framework are the guidelines of the legislative framework for civil registration, vital statistics, and identity management, where when we discuss legal identity, we also have first and foremost importance of the confidentiality and the privacy of data. And that means that there needs to be a legal framework that clearly identifies the access to the individual records, the interoperability and the relationship between different components of the system, between the civil registration, between statistics, between population registers, and between identity management systems, that would ensure all of the population, the individuals, about the legal boundaries and the legal protection in terms of functioning of these different components. We have also, again, later during this event, we are going to showcase the completeness of the civil registration worldwide. We do know that, that there are countries where the completeness is still quite low, and that is why we developed the fourth piece of the methodological framework, which is the Handbook on Civil Registration, Vital Statistics, and Identity Management, Communication for Development. So this piece essentially provides the contemporary approaches to ensuring that the registration of vital event is reported by those that need to report, by parents in the case of live births, or the relatives in the case of deaths, and that there is a clear understanding for the population about the benefits and advantages of this recommendation. The fifth piece that we have put in place last year was the implementation of the United Nations Legal Identity Agenda, United Nations Country Team Operational Guidelines. So, as we all know, the implementation has to be done in the field, and we do know that there is in the reform of the United Nations, the new network of resident coordinators has been firmly put together, and we took the advantage of this network to make sure that the work in the field, when it comes to the implementation of the UN Legal Identity Agenda, is really guided by one UN approach, that all the country teams components are fully aware of the need to develop certain segments in the country where they deliver their mandate. And for this, we put together these guidelines that clearly outline what needs to be done and to which extent. So this is from the normative point of view that we developed for the implementation of the UN Legal Identity Agenda. I will now pass the floor to my colleague Kirsten Dimartino from Unicef to brief us further on what we did in the past year. Kirsten, please go ahead.
Thank you very much, Surgeon, and good morning, good afternoon, good evening to everybody who is joining. As Surgeon already pointed out, one of the key objectives of the UN Legal Identity is to enable joint UN support to countries for the implementation and acceleration of this agenda. And it is also to focus on us having, as the UN, one approach and a more coherent, integrated UN response at the country level to the issue of legal identity and birth registration, and of course working together with all key stakeholders at the country level, including the World Bank, to accelerate this important agenda. At the request of the Deputy Secretary General, we were asked to prioritize countries in Africa. This does not mean that the UN Legal Identity Agenda should not be a global initiative, and certainly we will be looking to expanding this year also our support beyond Africa. But we were asked initially to prioritize Africa, and UNECA was tasked by the DSG to lead the engagement in Africa in close collaboration with the AU and, of course, the UNDIA task force members and the co-chairs of the UN Legal Identity Task Force, UNDESA, UNDP, and UNICEF. So the UN Legal Identity Agenda was initially launched in October 2019 at the 5th Conference of African Ministers responsible for civil registration in Lusaka, Zambia, and Surgeon was there to represent us, of course. And at that conference, 13 countries in Africa expressed their interest in accelerating this agenda. And these countries included Cameroon, Cote d'Ivoire, Democratic Republic of Congo, Ethiopia, Guinea, Kenya, Liberia, Mozambique, Niger, Nigeria, Senegal, Sierra Leone, and Zimbabwe. So these countries made a strong commitment at this conference to invest more in accelerating the legal identity agenda at the country level, including birth registration. So why is this important? This is incredibly important because the number of unregistered children under the age of 5 in these 13 countries is about 60 million children. So this accounts for slightly more than 1 in 3 of all unregistered children worldwide. So at the current rate, only 3 of these 13 countries are on track to achieve universal birth registration by 2030. But if we accelerate progress, we believe we can make a difference in all these countries, and that 7 of these countries could achieve potentially universal birth registration by 2030. So this is a tremendous opportunity, a tremendous commitment, and really an opportunity to shift the needle and accelerate progress towards achieving SDG 16.19. So moving on, what have we done? In 2020, UNECA led country assessment missions to 10 of the 13 countries before the pandemic lockdown. And these assessment missions included government representatives, UN resident coordinators, and of course all the UN country teams and all the agencies working on the ground. And we will be hearing more from UNECA later on their missions and the work they have done. Based on the outcome of these assessments and the recommendations provided, on the implementation of the UN Legal Identity Agenda, we also issued a call for proposals for seed funding in the fall of 2020 to be submitted by the DRCs with a submission from at least 2 UN agencies at the country level and the endorsement of the UNCTs to ensure a common UN approach moving forward. So 8, we reviewed all these submissions carefully based on objective criteria, and 8 of the 10 countries were selected to receive seed funding, and they are currently in the process of receiving this seed funding. 2 of the countries did not directly receive funding, but they are receiving funding bilaterally through UN agencies such as UNDP and Unicef to advance the UN Legal Identity Agenda. So basically, we're happy to report that all 10 countries are receiving one way or another, financial resources to really kickstart the process and accelerate this agenda. The idea is that countries use these funds so to say, to lay the grounds for the work ahead, to review their policy, legal frameworks for the advancement of the agenda, to establish coordination structures and mechanisms across the UN agencies with other stakeholders such as the World Bank, the EU, or other stakeholders at the country level, to work together on this agenda moving forward, but also to seek opportunities to leverage additional resources, working closely with partners on the ground to advance this agenda. So another important point is that we are looking also to address some of the critical risks and gaps in advancing this agenda and implementing the UN Legal Identity Agenda as we move forward in the implementation of this agenda. There are some areas that we want countries to pay particular attention to, such as data protection and privacy, the use of biometrics, the and how innovative solutions are used and technology is used to accelerate this agenda. But we also want to ensure that they, promote the involvement of civil society, that we pay particular attention to potential risks of exclusions of certain groups of population, and that we also try to bridge the humanitarian development peace nexus. And of course, as Sergen has already pointed out, that we also focus on overcoming and mitigating some of this disruptions that may have been brought about by the COVID-19 pandemic. So finally, just one final point. In order to support all these efforts, we have produced UNCT guidance, operational guidance to support the UNCTs to roll out and operationalize the UN legal identity agenda at the country level based on the normative framework and the different definition and approach we have adopted through the UN ECOSOC. And these guidance are now available both in English and French for the countries to use. So I will leave it at that. Thank you so much. Over to you, Sergen. Thank you.
Thank you very much, Kirsten. Thank you. I would like now to invite Niall McCain from UNDP to take the floor. Niall, please go ahead.
Thanks a lot, Sergen. Thank you, Kirsten. Greetings to everybody from a very sunny Brussels this afternoon, this Friday afternoon. And once again, we want to thank not only everyone that's on this call, but in particular, I think the 3 member states that have joined with us to support financially the implementation of the UN Development Agenda over the last year or so. So that's our colleagues in Japan, and we will be hearing from them later. Our colleagues in Permanent Mission of Switzerland and the Swiss Development Cooperation, and our colleagues in SIDA in Sweden, in Stockholm. So thank you once again for that. Just to mention a couple of the points that Kirsten mentioned around activity at the global advocacy policy level before we go into the country level implementation work that William in UN Economic Commission for Africa will be detailing in more detail shortly. This is very much an interagency effort implementing the UN legal identity agenda, and as Sergen mentioned at the start, there's quite a number of agencies that are formally part of our task force, including, for example, the International Organization of Migration, the World Health Organization, UN Population Fund, UN Women, UNHCR, the World Food Programme, pretty much every agency of the UN that is involved somehow in registering people or supporting member states to register their own people. So we've divided the work between many of the agencies on the task force, and for example then work that we have started in 2020 and will complete in 2021 includes, as Kirsten mentioned, a study on the use of biometric technology. Many of you listening might be aware that there are in fact very, very little, if any, what we would call international human rights standards around the use of biometric technology. Indeed, within the UN system, the Security Council Resolution 2396 on combating terrorism is one of the only documents that I can think of that speaks about use of biometric technology by UN member states for a particular purpose. So with our colleagues in the World Food Programme, we are currently mapping all of the activity of the UN system that use biometric technology within member states, so that ultimately we can come up with a set of principles, UN system-wide principles on their use, and then see if we can, in cooperation with one of the UN member state organs, see somehow is it possible to adopt a UN system-wide and a UN member state-wide policy around use of biometric technology. That will be completed in the first half of this year. We are also with our colleagues between our colleagues in the UN Department of Economic and Social Affairs, the Statistics Division, and ourselves in UNDP, currently developing a methodology that will allow countries calculate the financial cost to them of people not being registered, people not having legal identity in the country. As everyone is aware, by having people that are legally invisible, not registered, whose birth was never registered, are not part of any national ID, system, for example, those people unfortunately tend to live in what we would call the grey economy, not paying social insurance contributions, not paying taxation, not able to benefit obviously from social insurance schemes, etc. And there is a financial loss then to those countries by not having these people registered. Allowing countries calculate just how much cost is lost can go a long way to convincing and showing those countries why it is necessary then to make sure that everybody is registered from birth to death. One other piece of work that we're doing with the International Organization of Migration is around the issue of standardizing national identity documents for the purposes of cross-border travel in years to come. Many of you, again, will be aware that in some parts of the world, like in the European Union, you can travel between countries with a national ID card due to agreements that have been reached at the EU level around the standards and technical specifications of those documents. Indeed, many of you will also be aware, and I believe some of our colleagues of the World Bank are on the call right now, of a current initiative in West Africa that is also developing similar types of standards or specifications around allowing national IDs to be used for cross-border travel as travel documents. So with our colleagues in the International Organization of Migration, we are doing now a best practice guide on how to develop standards and technical specifications in this area so that regional economic groups in parts of the world or indeed between regions globally might be able to come to cross-regional agreements that would allow people to travel visa-free and passport-free across international borders. Then finally, within UNDP, we are developing this year for the purpose of all of the task force and indeed all of the member states, what we would call a best practice implementation guide around the issue of protection of personal data and protection of privacy. At the moment, the UN has probably been less active as it should be in advising member states on how to, for example, establish robust legal and institutional frameworks for data protection and privacy that would, for example, advise on establishing data protection authorities, information ombudspersons, data commissioners, etc., drafting good data protection law. And so we are working on that and hopefully will be able to publish such an implementation guide in the next number of months. I think it's best if I leave it at this, Sergeant, and hand back to you. Thanks.
Thank you very much, Niall. Thank you all, and Kirsten, for this overview of the UN, of the activities of the UN Legal Identity Task Force in the past year and what we are planning to do. Not all, of course. We presented just some of the few more salient items that we will be focusing upon in this year. I would like to open the floor for perhaps a few minutes if there are any interest in putting some comments, questions, or suggestions on any of the presentations that we have heard so far. So the floor is open. Please raise your hand, and if you want to follow up with a question or a comment. Very well, thank you very much. So we will now proceed with the second segment of our work program. The second segment focuses on the impact of the pandemic and on the completeness of civil registration worldwide. So with this, allow me then just to load the presentation and to start it. Very well. So I would like to present on the work that we have done in the previous year, trying to document and to monitor the impact of COVID-19 pandemic on civil registration and production of vital statistics. So the UN Legal Identity Agenda, we already mentioned that we what is the model? The model consists of the functioning civil registration, universal registration of vital events, translated into statistics, and then, of course, ensuring legal identity for all from birth to death. So, and then starting in February, as we all know, 2020, the spread of the SARS-CoV virus that causes COVID-19 was overwhelming all the countries in the world. And then the WHO, the World Health Organization, declared the pandemic in March. And of course, the number of countries started to introduce different measures, lockdowns, and then limits in terms of limits of movement and cutting down on a long list of economic, social, and government activities in order to mitigate the spread of the virus among the population. And that has an impact on the functioning of civil registration as well. And it was quite considerable and was also compounded by stretching the capacity of national civil registration system to register increased number of deaths due to the virus itself. So what we did at the outset of the pandemic in April, May, we did launch a survey to worldwide, to all the civil registration authorities worldwide, and we asked several questions, among those whether the civil registration is considered an essential service in the country. As we all know, in a number of countries, they made the distinction between what is an essential service that needs to operate despite the pandemic, and all the others that were deemed non-essential and therefore were essentially closed in terms of delivering services and delivering the mandate. Provided that the civil registration, which means the registration of births, deaths, at least, would be an essential component of the functioning of the government, is something that we took as for granted. However, as we can see here from the reply to the first of our questions, what was the impact, the direct impact of the pandemic in terms of whether the civil registration was an essential service in the country? Quite a few countries replied negatively. So then we did ask also a question, what was the impact of COVID-19 on the registration of vital events and the functionality of the civil registration authority in general, and what kind of measures the civil registration authorities undertook in order to still provide services to the countries, but then at the same time ensuring the safety of both the delivery delivery subjects such as the civil registration and the population that they serve. So we received the replies from 67 countries of areas. All of these replies are available here. I will not go into details because a number of countries really provided a very comprehensive elaboration of the difficulties that they were facing. So we also prepared a paper, a paper that provides an overview of the results of the survey, and that paper is also available on our website. So what we concluded from the survey is that even if the civil registration was designated as an essential service at the outset of the pandemic, the particular and strong set of measures aimed at mitigating the impact of the pandemic and on the disease can nevertheless have adverse impact on delivering of the responsibilities of civil registration services. So what was essentially the reasons? The lockdown and the reluctance of the population to report and to approach the civil registration offices in order to expose themselves to the virus, and much lower registration of vital events in the circumstances of being designated as an essential government service. So the importance of designated civil registration as an essential service cannot be underestimated, and it was strongly recommended by maintaining civil registration and vital statistics during COVID-19. And we put together, as UN Legal Identity Task Force, recommendations in that respect. And these are all available on the website that you can see here. So the survey documented that countries around the world introduced a set of measures intended to enable the functioning of the civil registration in the COVID-19 pandemic. Less rigorous interpretation of the law, faster registration, not asking all of the necessary documents that would be requested in normal circumstances. The measures for maintaining physical distancing and use of PPE, of course, and waiving of the fees, which was one of the more important points that were introduced in a number of countries in order to ensure the full registration of the occurrence of vital events. A number of countries also started to look at the solutions, and so they saw this as an opportunity to actually modernize their civil registration system, primarily by way of computerization. And this is one of the major international recommendations, the computerization of civil registration and vital statistics, a contemporary requirement placed on the civil registration system. So the countries, faced with the fact that the civil registration officers need to work from home, started to develop applications, digital applications, to ensure that the population that needs the birth certificates and the death certificates has access to the system. So it is definitely an imperative to put together the computerization of civil registration system in as fast as possible manner. And we have documented in our surveys that a number of countries started to do that during the pandemic in order to mitigate the negative and adverse impact on the availability of registering vital events such as Rwanda, Costa Rica, and Georgia. Another considerable source of data that we developed during the past year on the function of civil registration consisted of a set of workshops that were developed by UN Legal Identity Task Force and the Global CRVS Group, Global Civil Registration and Vital Statistics Group, and the UN Regional Commissions covering Asia and the Pacific, Africa, and Latin America. These webinars provided an opportunity for civil registration authorities in these regions to exchange experiences and practices in terms of functioning in times of the pandemic. Approximately 50 countries participated in total, and the deliberation and relevant documentation illustrated difficulties and obstacles faced by those countries. All of those are available at this website here. There are two major observations that emerge in this process from both the survey and the webinars. The first relates to the fact that the registration of vital events, primarily births and deaths, decreased noticeably in a majority of participating countries as a consequence of difficulties and obstacles in ensuring regular functioning of the statistical of the national civil registration system. The population, fearful of being exposed to the virus, was reluctant to approach civil registration and report the occurrence of vital events. Locking down the people at their homes also resulted in major difficulties in terms of reaching a civil registration office. And simultaneously, the decrease was also due to the fact that in a number of countries, the links between health institutions and civil registration that are functioning in normal circumstances either weakened or broke altogether as a result of partial or full closure of civil registration offices, and moving to telecommuting as one of the measures aimed at mitigating exposure to the virus. So this is one of the major consequences that the system that was functioning before in terms of health institution informing of the occurrence of vital events definitely was adversely affected by the fact that the civil registration system had to shut down and to start working from home. The second observation refers to countries that were able, and there were quite a few, to run their civil registration systems uninterrupted. And those uninterrupted meant that the system was functioning and was producing the data that are necessary for making informed policy decisions in times of pandemic. So what we, in those countries, what we noticed and documented is the number of excess deaths. That means the number of deaths that were in excess of those that would, that compared to the previous years. We do know that there is a time series, of course, very essential way of very useful statistical instrument to assess the dynamics of different economic and social phenomena. So in this case, what we did notice that the number of deaths, primarily due to COVID-19, whether directly or indirectly, was increasing significantly. However, and this is one example here, just a small example of one country where you have the discrepancy of the data that are coming from the health sector and the statistical official statistics, where you have the excess deaths in the civil registration system being considerably higher than those reported as directly caused by the COVID-19. So this is now really calling for further investigation on how to essentially ensure the harmonization of the data on deaths that are due to the pandemic. So the way forward, we have 2 points here. We have the excess deaths in the countries that were able to run their civil registration system uninterrupted during the pandemic. And then we have the decreased registration of births and deaths in marriages in countries where the civil registration was severely interrupted. And then, of course, we need to look at contingency planning for instantaneous disasters and for prolonged disasters. First, about the excess deaths, I already mentioned the issue. I'm not going to go into more details here, other than pointing out the fact that on 19 February, just a few days ago, the UNDESA WHO Technical Advisory Group, high-level technical advisory group on COVID-19 mortality assessment, conducted its first meeting. So this group is focusing, bringing together statisticians, demographers, health professionals, and other government representatives in order to make sure that the proper assessment of the deaths due to COVID-19, be it directly or indirectly caused, is properly assessed, and that the system is put in place in order to make sure that in case of next pandemic, the system would be functioning in a more accurate manner. So for those countries that have noticed the decrease of births and deaths during the pandemic, there needs to be a number of rectifying instruments put in place. So they need to work on developing and launching a broad publicity campaign emphasizing the need to register births and deaths that occurred during the pandemic and were not reported nor recorded. They also need to remove any fees that they may have for late or delayed registration there. So to provide an incentive for the population to report on those events that occurred but are not being reported nor registered. And then to reestablish the link of between the health sector and all the other sectors in order to make sure that the harmonization of the data that are being produced took place. In terms of the contingency planning, in the post-pandemic time, when it comes, countries need to develop detailed and comprehensive contingency plans in case of disasters, albeit not all disasters are similar, and therefore the distinction. For instantaneous disasters, we here refer to the occurrence of events that cause instant destruction and harm, such as earthquakes, tsunamis, flooding, and similar. So in this case, National Civil Registration Service needs to develop comprehensive instructions to maintain the registration of primary births and deaths that may include guidelines shortening the process, expanding the list of eligibility of informers, establishing process waivers for missing documents, for example, suspend all the fees. And then for those disasters that are more longitudinal, like the pandemics, we need to develop a detailed contingency planning document that would address multitude of topics, to revisit legislative framework for civil registration, to assess the need to adjust it in terms of contingency planning if it's not there already, institute and test various solutions to ensure the functioning of the civil registration services in times of prolonged movement restrictions, for example, all logistical challenges such as the number of personnel, increasing the personnel, working hours, protection measures, and so on and so forth. So the most critical, after all of this, the work that has been done in documenting and monitoring the impact of the pandemic on civil registration and, of course, the production of vital statistics, there is one conclusion that essentially comes very strongly upfront, and that is that the most critical, crucial, and imperative undertaking in the wake of COVID-19 should be the digitization of the civil registration and vital statistics system and apparatus, as this is proved to be a unique factor to ameliorate the impact of this pandemic and to also ensure that the civil registration is firmly embedded in the legal identity management model the United Nations calls to be implemented in all member states by 2030. So this is just a short walk through a number of sources that were all presented here in the presentation about the impact of COVID-19 on civil registration and vital statistics. There are many other sources and many other activities going on now in the countries that also needs to be mentioned. But this is something that the UN is obviously very concerned about and putting a lot of effort to document and to make sure that the countries have the proper advice ready for mitigating the impact of COVID-19 in terms of civil registration and vital statistics. So thank you very much for listening to this presentation, and we will move right now to the next one, which is a short overview of the completeness of civil registration overall in the world and the work that we are doing in order to provide and monitor the functioning of civil registration systems worldwide. So my colleague Predrag Savic of UN Statistics Division will guide us through the presentation. Go ahead, Predrag.
Thank you so much, Srđan. Good morning, good afternoon, and good evening from me as well. I'm Predrag, part of the UNSD, and I will just briefly go through some of the updated estimates of completeness of birth and death registration that we now have available on our website. So please do take a look. As you all know, the UNSD has been assisting countries since the inception after the World War II, and the progress on CRVS systems have been made in most of the countries. However, as we've heard from other speakers, the coverage gaps do remain. So I'm just going to go through some of the sources of the data and briefly over the latest available estimates we have on coverage of birth and death registration. Several sources are used to obtain the latest estimates. We have it for more than almost 230 countries, territories, and areas around the world. The primary source is the demographic yearbook system, specifically the questionnaire on vital statistics that's dispatched every year to countries. There's a page on that questionnaire referring to quality of vital statistics obtained from civil registration, and that is our primary source of data. Secondly, it also includes the UNSD workshops that have been conducted in the past when coverage information was obtained from country representatives, such some of you here present from NSOs or civil registration authorities that attended the workshop. And lastly, when none of those was available, we use demographic and health surveys, DHS, and mixed surveys done by our colleagues in Unicef, as well as WHO data. When it comes to mixed survey, it's part of the module on children's questionnaire for children up to the age of 5. And when it comes to DHS, it's part of the household questionnaire. So we do have data on that as well. And mostly for low-income countries, that happens to be the only source of data that we have. As I mentioned, birth and death registration coverage gaps do remain. When we look out of all the information we have, out of all the countries for which data is available, on average, around 7 out of 10 or 73 countries register at least 90% of all the births that occur. And when it comes to death registration, the figure is somewhat lower. It's 68% of countries that register at least 90% of deaths. I do have to point out that this is out of all countries for which data is available, and there are many countries for which we do not have this data. So we can assume that these numbers are actually even a bit lower. There are large differences when it comes to world regions. Here I have just the share of countries that register at least 90% of all the births. So we see that in Australia and New Zealand, as well as Northern America and Europe, it's all the countries. And then they're followed by Western Asia and Northern Africa, where some gaps remain, then Latin American, Caribbean, Eastern Asia, Southeastern Asia, then Central Asia, Southern Asia, and in the end, we have Oceania, excluding Australia and New Zealand, of course, and Sub-Saharan Africa, where just a quarter or 25% of countries register more than 90% of their deaths. It's just a little map. You can see detailed information for each country on the website. But as I said previously, we have in a dark green countries in which more than 90% of the births are registered. And we can see large parts of Asia, Europe, Northern America, Latin America as well, with certain exceptions such as Ecuador, Peru, Venezuela. But what we see is mostly on the yellowish part, which are the countries in which less than half of births get registered. And we see Papua New Guinea in Oceania, for example, Afghanistan and Pakistan in Asia, Yemen, and then large parts of Sub-Saharan Africa. Obviously, these countries are in this map lumped together, but there are vast differences between them as well. So in Ethiopia, it's 3%. And then in Zimbabwe, it's 49%, according to the latest data. As mentioned, all the countries have committed to having birth registration and legal identity for all by 2030, and it's part of the SDGs 16.9, and there is 8 and something years left until then. When it comes to death registration, the situation is, as I mentioned, a bit trickier. Here we again have Australia and New Zealand, in which all the deaths get registered, but then Northern America and Europe falls to the second place thanks to Albania and Monaco, which for some reason doesn't register more than 90% of all the deaths according to the data. And then it's followed by Latin America, parts of Asia, Oceania again, and then Sub-Saharan Africa in the end, where less than a fifth of countries have a fully functioning CRBS system. Again, we can see the same type of map, and here what is most striking is, I would say, the gray part, which are the countries with no information. So as you can see, we lack a lot of data from parts of Asia and Africa as well. And a couple of final comments. Systematic recording does remain a challenge. There's urgent need to improve and strengthen the CRBS systems, especially if we look at this map. Some of the most populous countries in the world, such as Pakistan, DRC, Nigeria, Ethiopia, have some of the biggest gaps in coverage. So when you translate these percentages to absolute numbers of real people, it really means that millions and hundreds of millions of births and deaths do not get registered. One more point on the lack of any data that I mentioned. When it comes to birth registration, we lack data for 4 countries. And when it comes to death registration, we lack data for 44 countries, which is quite a number. Obviously, there are differences between CRBS coverage and registration levels captured by household surveys. Sometimes the household surveys, actually often, or always, in case of DHS and mix, they focus on children up to the age of 5, whereas the questionnaires focus on a specific time period in which all births are registered. There are also some differences between DHS and mix themselves in the same country, even though with a year or 2 years gap. And obviously this is, for the end, this is a work in progress. We will keep updating, so please do visit the UNSD webpage and provide feedback and let us know. Thank you so much. Back to you, Sergio.
Thank you very much, Predrag. So this is the latest update of the data on completeness and coverage of civil registration that we are maintaining on a routine basis, regular basis. However, we also are keeping track of the previous versions of this spreadsheet, and those are also available on our website. So if one wants to compare between, say, what was the situation in 2017 and today in each country, that is also available from our website. So with these 2 presentations, we do conclude a kind of walk out through the global aspects of the UN legal identity agenda, and we are now turning our attention to Africa and to the work that has been done by our colleagues from UNECA. Before giving the floor to William, I would like to open the floor for any questions or comments on these two presentations, on the impact of COVID-19 and the updates on the completeness of civil registration data produced by UNSD. Any comments? Please raise your hand, or questions. Yes, Mr. Obudo, please.
Thank you so much for this for the two presentations. Actually, they're quite informative and well structured. Now, my concern, I'm from Kenya, the Director General Kenya National Bureau of Statistics. Now, when I look at the graph for the vital registration, both births and deaths, for sure Africa is lagging behind by far. And I'm just concerned that are we not able to learn from what the other countries around the world have done, so that it can also be improved? What is the technicality involved so that makes the African case so low like this? Thank you.
Thank you very much. We also have Florian Forster. Please introduce yourself first and go ahead.
Hello, yes, Florian Forster, Head of Division Immigration Border Management at the IOM. I will speak later again. Questions to Serkan. So the main takeaway to make CRVS more resilient to external shocks, I understand, is it this digitalization? Is that the let's say conclusion we can take home at this stage? Thank you.
Thank you very much. Any other comments or questions? Let me address then the comments from Kenya and from IOM. We have another one, Malatela. Please go ahead and introduce yourself first.
Hello, thank you very much for the presentations. My name is Malitela Duanenkhatsi. I'm with the Global Financing Facility supporting the work on civil registration and vital statistics. I just have a quick question on the estimates provided. While I understand that most of the data is derived from the surveys, just to check whether the UN has a system of getting the actual data where available from the countries themselves on the number of births and deaths registered on a year-to-year basis. I'm just looking at the, I think, reference made to the 3% in Ethiopia and noting that some work has really been done over the last 3 years, where coverage is much higher than that. So just to check whether there is that maybe consistent way in which we get maybe annual figures from the countries and the data coming specifically from the civil registration system. And thank you very much for all the presentations.
Thank you very much, Malatela. Let us address the issues. From Kenya, unfortunately, as we have presented on the map, for a number of countries in Africa, we do not have really any information available about the completeness of civil registration in those countries. We do have some information that is coming again from the surveys, the household surveys, either within the mixed system or the DHS. However, we do strongly, and especially within the APAI CRVS construct that is put together in Africa, we would like to see that the civil registration systems in Africa are actually being held to task in terms of performance and in terms of extending their services to all of the population in order to achieve universal registration and reporting of at least the births and deaths as major vital events. But that is simply not the case at this point of time. There are improvements, of course, and we are documenting them and we are presenting them. This is really not the purpose of this presentation is a call for action. It is an alarm. It is actually ringing a bell, and then trying to put the lack of information, the lack of data, as a kind of incentive for the countries to take over and then ensure that their systems, that are government-operated systems, function as they should function. So it is with our work that is going to be presented just by my colleague William from UNECA. We are doing this in the field, and hopefully next time around, when we present this data, the situation will be quite different. As for the yes for IOM, definitely digitization is the ultimate message. Digitization of civil registration, interoperability between civil registration systems, national statistical systems, population registers, and ID management systems in a digitized manner is the solution, permanent solution, and long-term longitudinal solution for the functioning of the registration. Without the birth certificate, there is no legal identity of a person. We do have really this scandal of invisibility, babies that are born without birth certificate and then dying, living the whole lifetime without any kind of legal identity in the proper sense of the word. And this is something that can be addressed in the current contemporary situation by digitizing the services, primarily civil registration services, interoperable with health services and all the other components that I have mentioned. As for the question about the source of data for the completeness, we do run the United Nations Demographic Yearbook system for over 70 years now. And one of our routine operations is to collect information from all the countries, from national statistical offices and government institutions about the issues that are pertinent for statistical system. Hence, what the primary source of information are the official replies to the questionnaire from the UN Demographic Yearbook. So when like the case that we mentioned here in Ethiopia, this is the information that was submitted by the official statistical source in the country. And then if we do not have the information coming from the Demographic Yearbook, the second then source are the workshops that we organize and webinars. And here we collect the data directly from countries because we are interacting with national representatives. If none of these two is available, then we are moving to the next step, which are our colleagues from Unicef are collecting through the MIX program and the USA through the DHS program. So this is because these are surveys, and they may be representative at the level of the nation, but they simply cannot be disaggregated at the lower level. And the importance, essentially, of taking measures is in the locals. So what we are advocating is a functioning of the systems throughout all the country and the measurement of the function of the system also at the local level. The surveys provide us the information at the aggregated level, but not at the disaggregated level, and that is why we put them as a third source, relevant source for our data. I hope that this explains in more details the process that we are undertaking for presenting the national estimates. The first priority is given to the official communication for the government via the United Nations. It's an intergovernmental organization, and we essentially need to address the government authorities first and foremost. So with this, allow me to move to the next segment. The next segment is the UN implementation in African pilot countries. We do have with us Mr. William Mukwaba, who is the Chief of Demographic and Social Statistics in the African Center of Statistics in UNECA. William, please go ahead. You have the floor.
Thank you so much, Sejin. Let me welcome everybody who is on this side event. Just a minute. Let me upload again. Can I ask product to load from your side, please?
Yes, no problem.
Okay, while we are waiting for the presentation to load, as indicated by my colleagues from UNSD, Unicef, and UNDP, country implementation of the UN legal ID has commenced on the continent. Next slide, please. And we have some guiding principles in terms of the country level implementation, which is to promote the country-led initiatives on a holistic approach and integrated legal identity. Then secondly, coordinating country implementation efforts in Africa. As Kirsten mentioned, the implementation was actually prioritized for Africa. I think for reasons which are very obvious, that the largest proportion of the population who are invisible are actually in Africa. So it was critical that the program starts in that region. Then thirdly, standardizing approaches across countries globally, advocating for civil registration as the foundation for legal identity. And this is based on the principle that an individual should be recognized as soon as they enter into a population that is at birth, and they are exited at death when their contribution in the population ceases to. Although some of the social and economic impacts of the death still remain, for example, if there are claims of inheritance and so forth. Then fourthly, to align UN-LEA with ongoing activities like the Upper Sierra VS ID for Africa, ID for D. Next slide, please. So, as indicated previously, 13 countries were selected, and let me just go through the selection criteria. I think it will help to explain a lot of questions which people have actually been asking in terms of why only in 13 countries. Based on the resources which were available at the time, we estimated that we could only do, initially it was 9 countries, and as we went to the conference, the 5th conference of ministers in Lusaka, Zambia in 2019, another 4 countries strongly indicated their willingness to participate in this program, and that those requests were actually accommodated. So the selection criteria was based firstly on the under 5 birth registration coverage from the sources which product indicated. Then secondly, the status of the country's CRVS and ID management assessment. So we were actually looking at countries which were already making progress in terms of CRVS and ID management. And this is basically because the lifespan of the UN-LEA was determined to be 2025, when we are supposed to reduce invisibility by about 300 million. So obviously, with only 5 years, we actually had to look at countries where something was going on. Then the existence of CRVS and ID management improvement plans, as indicated, a number of countries, actually like now, 42 countries in Africa had done their strategic plan, their comprehensive assessments. So we looked at those which were actually practical, which were easily implementable. Then the fourth criteria was looking at existing national coordination mechanisms for CRVS and ID for the same reason, existing opportunities for integration. So countries which were already moving towards integrated systems, then World Bank engagements at country level. Those are countries where at least ID4D and the GFF were existing or are existing, and the status of the policy and legal frameworks in those countries. Then also the regional sort of representation of Anglophone, Francophone, and Lusophone. The 13 countries are actually listed there: Cameroon, Cote d'Ivoire, DRC, Ethiopia, Guinea, Kenya, Liberia, Mozambique, Niger, Nigeria, Senegal, Sierra Leone, and Zambia. Next slide, please. So how were the assessments done? These were rapid assessments which we actually aimed to look at what can be the entry points in these countries. So we devised a methodology where we could collect the data within a very short space of time, which was actually like in 1 week. So we looked at desk reviews of the civil registration, vital statistics, and ID management documents in those countries. We had individual and institutional consultative meetings with all the UN entities which could present themselves, with the government ministries responsible for civil registration, vital statistics, and ID management. Then the development partners, so we looked for the World Bank, the EU, GIZ, CEDA, all these development partners which have a stake in civil registration or ID. We also included private companies engaged in the work on identity management. We know definitely private companies are interested, especially those which are working at offering, hardware and software for registration and so forth. So we actually wanted to engage them for specific reasons, especially, the experience which some African countries have had in terms of vendor locking of programs and so forth and so forth. Then we also engaged with high-level government officials in a number of countries. We were fortunate enough to speak to the relevant ministers, deputy ministers, director generals, and permanent secretaries. I think in all the 10 countries which we did the assessments, at least we managed to get some of those high-level government officials. Then on the closing day, we held a national stakeholders workshop where we developed the roadmap with each of the countries. So what was involved in the country assessments, firstly, was to identify the size and characteristics of the population without legal identities. And this is crucial in the sense that it determines who are actually being left behind. Then secondly, we looked at the effects of lack of legal ID information on human rights, and our UN entities dealing with human rights, we actually engaged with them on this, and in specific countries, they could actually give us the impact of populations which were actually being marginalized, like the stateless, refugees, displaced people, and so forth. Analysis of civil registration, national strategies. As I indicated, we have almost 75% of the countries now in Africa have national strategies. So we had to interrogate them and see how they fit into the UN legal ID approach. Assessment of the ID management systems, and we actually noted that the Francophone and Anglophone countries differed a lot, where in Anglophone countries, these tended to fall in the same ministry, possibly in the same department. You have the ID management, you have the CRV, the civil registration, and so forth. So obviously, coming up with the recommendations would definitely differ between Anglophone, Francophone, and Lusophone countries. Then we looked at the opportunities for integrating CRVS and ID management. What were the quick wins? That's what we're looking at. Next slide, please. We had some conclusions. I've just summarized those which are very important. I mean, there are more, and there are some which are country specific, which are contained in those reports. And the first recommendation is the interoperability through digitization. I mean, for civil registration and ID management, they are actually converging towards holistic approach by introducing interoperability. And I think Kenya, we have the Director General here, you will talk about that. That's one very good case study where that convergence is actually happening. Then digitalization of paper-based records and advanced in technology in integrated approach. So we noted in a lot of countries, they still have had a lot of paper-based records dating back in the colonial periods and so forth. And they were struggling in terms of how do they actually handle, the storage and so forth. So digitization also was one of those. And I know of countries where they are actually working both forwards and backwards. That is, backwards trying to make sure these records come into the system, and forwards to make sure that any registration they do currently is digitized. Then demand creation, which is very, very critical, and I think it's one of those issues which we noted was not being given priority. But demand creation relates to how communities perceive the usefulness of identities. Because if somebody doesn't really see the use of the identity, if they've been excluded from school and they are not working, they're in the informal sector, at times they actually don't see the reason why they should actually be having that. Then coordination, we are looking at a number of government institutions coming together to have these interoperable systems. So how does coordination work between civil registration offices, vital statistics, which falls in national statistical offices, ID management, which also falls in national registration bureaus and so forth. Also, I think we will hear from Kenya how they are actually doing this coordination. Then integration through population registers. We know, and from the experience of our colleagues in the Asian region, that population registers are the way to go. And they bring this interoperability into action, because in the population register, everybody in the population is actually in that register. So ID can utilize that when people reach the certain age which they are required to, the system should indicate to them who are now eligible for IDs and so forth. Then collaboration with Ministry of Health. I think Sejin talked about it a lot, especially with our experience during the COVID-19, that if events which are occurring within health institutions are recorded at health facilities, we tend not to lose some of those events. And one thing which is now very certain is using technology like cell phones or, it is easier to have a notification done even if the document or the credential is not collected immediately. At least this allows for the event to hang in the system, and when the credential is required, the extra information is needed and so forth. So it reduces the likelihood of losing that vital event. Then lessons from COVID, also Sergeant has talked about it, that we noted that CRVS has to be an essential service. And I'm very glad to say that from this message, we have a number of African countries, I think, who heeded to this recommendation, and they went to their authorities and they've been granted essential service status. I think 3 countries which I can think of at the top of my head. Then the second aspect being developing of a robust disaster management and resilient systems, having business continuity plans to guide response during such times. So whether it will be just a short emergency or a long emergency like we are now experiencing with COVID, there needs to be a business continuity plan which the Civil Registration Office can use. Next slide. So let me just...
William,
okay.
I'm sorry to interrupt, but we are really kind of running short of time. So would you please speed up a bit?
Okay, thanks, Sajid. So we have country level implementation, and I've just put in a number of countries. In Kenya, for example, we are assisting with the revision of the legal frameworks. We are, with the funds from the Japanese government, with the digitalization of civil registration, interoperability of systems through their NIMS, demand creation, as I have been talking about. In Liberia, it's almost like putting the systems in place in terms of establishing functional and integrated civil registration systems. In Mozambique, we are working on strengthening coordination mechanisms for the government ministries and departments, then establishing interoperable systems. In Zambia, we are assessing the completeness of births, deaths, and marriage, all the vital events, supporting review of existing legal frameworks, and advocating for data and private protection issues. Sierra Leone, strengthening coordination, increased public awareness on fundamental rights, registration of refugees, and so forth. DRC, support the consultative process for the family code, which is actually the legal framework, establishing a national coordination mechanism and DRC is really starting from, very low levels, then develop comprehensive law on data protection. Next slide. So the way forward, firstly, is building systems that produce data that enables communication between governments and the public. So this raises the confidence of the public in the system. And this is a very crucial point which we actually noted during the assessments, that the public has to have faith in the system, confidence. Secondly, increase investments on online-based platforms for registration. Thirdly, resource mobilization to adequately cover the intervention on legal identity. Then lastly, extend technical assistance and advisory services to the countries that need to build these integrated and interoperable systems. So thank you for that.
Thank you very much, William. Indeed, comprehensive presentation of the work that is being taking place in Africa, and then we are really, I'm sure, glad to notice the improvements and the work ahead. Let us move to the next presentation, which is on legal identity and global cross-border mobility, and we will have Mr. Florian Forster, Head Immigration and Border Management Division from IOM. Florian, please go ahead. You have the floor.
Thank you very much. I hope you can hear you. Can you see the presentation?
Yes, we can see. You can just run it if you wish.
Yes, and I just also send a quick question to William, but maybe we can do this later because we are short on time. Thanks for the good presentation, William. I want to keep it short. Presentation on legal identity and cross-border human mobility. My name is Florian Forster, Head of Immigration and Border Management at the IOM. I have planned a couple of slides. I will only speak to a selected number of them, looking really at the issue of how legal identity interlinks with cross-border human mobility. You see here the agenda. In the end, I will also look at more specifically, what does it mean now in the COVID-19 pandemic context. First, a couple of words about IOM, the UN Migration Agency. Don't want to go so much into detail. What maybe is important to know is that we have a dialogue function, a policy function, a program development and implementation function, also a service delivery function for our member states, and then for concerned migrants. We do not have a norm setting functions in the UN system. So IOM does not have a norm setting functions as regards border management, but actually some other bodies in the UN have. I will come to that. What is important about IOM, we have a strong capacity to implement activities in the world, also in very more remote or more security-phased situations. And I think that brings a strength to the table, that it's not only theoretical, that part is also there, but also a lot of implementation capacity around the world. The overall budget last year was around, 2 years ago, was around 2 billion. And our activity specifically in the immigration and border management field, which includes legal identity, around 140 million US dollars. Let me first go to a couple of tools to illustrate what we do there in the field of legal identity and cross-border human mobility. One element we do have is a border management information system, an IT system that registers entry and exit, but also has then a couple of interoperable operations that we make available for the member states. And that, I think, is an interesting, we call it MIDAS, the Migration Information Data Analysis System. It's an IT system that is running at borders, not operated by the UN, but operated, of course, by the individual member state who chooses to use that system. And what is important there is that if you think about this, the UN is providing an IT system. We are not the only ones. Unct, the United Nations Conference on Trade and Development, does this since many, many years very, very successfully in the customs field when it comes to customs management through its RC-CUDA program. Or we have now the United Nations Office on Counterterrorism, who does it with a new Go Travel program on advanced passenger information that is now being offered to member states. And then member states can decide whether they want to use this system or want to build their own system or buy a system on the market. But the UN systems, of course, are more affordable. And very importantly, the source code goes to the member states and does not stay, as it is often with private vendors, in the hand of companies. But of course, it's more a system that is also there for developing countries, not for the richest and largest countries around the world. I show you some other tools that we have in the world in the field of cross-border human mobility, border management, and legal identity, specific training programs, master classes. One is called here, a bit difficult to read, PEPM, the Passport Examination Procedure on how to examine travel documents, masterclass on ID management with the Dutch Ministry of Interior, the Identity or Nationality Office there, document explanation library for improvement, that's more secondary line, and then of course also the much wider essentials of migration management training packages. And we offer them around the world. So you see how closely linked legal identity is with cross-border mobility and migration management. Importantly, I wanted to highlight as well, we work together, IOM, since many years with other UN agencies, especially with ICAO, the International Civil Aviation Organization up in Montreal, on the TRIP strategy, the Traveler Identification Program. There we have a very strong element on evidence of identity. And actually, this is interesting and important to note. The International Civil Aviation Organization, member states of the UN coming together under ICAO, have a norm setting mandate and do use this mandate and agree on standards and recommended practices that are used around the world. Focus is on aviation, but as a matter of fact, the standards and the recommended practices developed for air border management, so people crossing the border at airports, is then largely also being used for land border management and also sea border management. So what we see is that within the UN, we have a body, ICAO, where member states come together, agree on standards and recommended practices, standards which are obligatory, and then this is also being used for land or sea borders. Importantly, just to add what Neil from UNDP has said, ICAO is an organization. In Annex 9, we have quite a lot of regulations, standards on the use of biometrics already. So I think this is another source. Neil, you also already mentioned UNOCT, Office on Counterterrorism, but also ICAO Annex 9. We have a lot of also already today existing obligatory standards as to the use of biometrics. For instance, with the e-passport, where we have biometric features, our face, and then either finger or iris, which is today already a reality based on UN set regulations. There are many other areas in there. I will not go into detail, but I think it's interesting if you're a bit more reading, if you're interested afterwards. Now, IOM is very active, is an active member in the United Nations Legal Identity Agenda Task Force. We are also now working on our own legal identity strategy linked to migration and cross-border human mobility. It will come out mid-year. I already listed here some principles and pillars. It's been discussed with the member states and also with our partners around. This will come out, so there will be now more consultations on that, and then it will come out mid-2021. What is important I want to highlight here is IOM's contribution is a strong engagement in the legal identity agenda and in the task force with a clear thematic focus on legal identity and cross-border human mobility and migration. This is important. It's in line with SDGs. We heard SDG 69 before. It is also very important and in line with the Global Compact on Safe, Orderly and Regular Migration. Objective 4 speaks specifically to the need of migrants to have legal identity and to the wider policy framework principles and values of the United Nations. I give you some examples what we are now currently doing there in this legal identity, what tools we want to offer there. The training classes, master classes, I showed some pictures before already. A standardization manual identity documents, already mentioned by our colleague from UNDP, where we work closely together. It's also part of the UN Legal Identity Agenda work plan. Also looking at free movement protocols, and also, especially in this context, and also looking at a manual of how to document migrants that already in a third country who have so far no proof of legal identity.
Florian, my apologies, sincere apologies. We are really running out of time, and we have two presenters left. Would you please be so kind to conclude? Let me just emphasize that all the presentations will be posted on our website. Please
I will do this, and I will speak very, very briefly. So COVID-19 had an enormous impact on cross-border human mobility, on migration, really an enormous impact. And now we're looking at what can be done. And I think one key development I want to highlight is the question, will there be, for instance, now vaccination certificates. How can those be linked to travel documents, to already established legal identities? That's one of the key questions we're looking at. And I think, I come to the conclusion with that, Stan. I think we come to a similar conclusion you have brought before for CBR, for your work field. The digitization, the better interoperability of those solutions we can bring to the table, I think that will be also a key element in the answer how to deal with the current COVID-19 crisis when it comes to legal identity and cross-border human mobility. Thank you. I leave it with that. Thanks.
Thank you very much. Thank you, Florian. Apologies for the acceleration.
Absolutely, it's fine. It's no.
We are now moving to our last, perhaps the most important segment, without the countries that support the implementation of the UNLEA with their contributions, and the countries that are willing to go ahead with the implementation. The work on the implementation of UNLEA certainly would not be as successful as it is right now. In that respect, I would like to invite Mr. Yumiya Nakano, who is the minister in the permanent mission of Japan to the United Nations here in New York, to take the floor. Mr. Nakano, please go ahead.
Thank you. Thank you very much. And let me begin by thanking UNDESA for giving me the opportunity to speak at this meeting on this very timely issue. Ensuring the right to legal identity, that is to be recognized as a person before the law, is an essential element in ensuring the human security of the most vulnerable people. While the importance of civil legislation is indisputable in normal times, it is all that much greater in the context of the pandemic. In order for governments to be able to assess the actual situation of infections of the COVID-19 and take effective countermeasures, the proper functioning of civil legislation and the collection of vital statistics is essential. There is also a growing need to strengthen digital infrastructures and to build capacities in the digital arena in order to adopt to the rapid digital transformation taking place worldwide under the pandemic. The project Legal Identity for All covers 3 countries in Africa, namely Cameroon, Zambia, Kenya, and is a part of the 2020 Japan supplementary budget contribution of $68 million provided to UNDP in order to urgently tackle and prevent the spread of the COVID-19 and cope with the negative impacts of the worldwide economic downturn. The main objective of the project is to promote civil legislation in order to provide personal identifications to the people and to strengthen digital infrastructure and build capacity to empower people in African countries. The government of Japan believes that harnessing the knowledge and technology of the private sector in these areas is essential to achieving the aforementioned objectives. In this connection, the Yokohama Declaration, adopted at TICAD 7 in 2019, emphasized the importance of good governance and digital transformation through enhanced public-private partnership. Engaging the private sector in the discussion is crucial in order to bring realistic and concrete perspectives to the project. While this is a UNDP project, the project is part of the Legal Identity Agenda promoted by Legal Identity Agenda Task Force. It is implemented in cooperation with UNDESA and Unicef, and in close coordination with the UN country team on the ground. Japan appreciates this holistic one UN effort, which is in the spirit of the UN development system reform, as well as the embodiment of human security approach, which we have been advocating. Finally, in order to achieve universal legal identity, it is essential to develop a comprehensive international normative and policy framework on civil legislation, vital statistics, and identity management. We have high expectations for the role of UNDESA in this regard, and we look forward to the early development and operationalization of such a framework. I thank you, Mr. Facilitator. Thank you, Chairman.
Thank you very much. Thank you, Mr. Nakano. Thank you for your address. It really highlights the commitment of the government of Japan to support the implementation of your legal identity agenda, and that is highly appreciated. Thank you very much for your kind words. We are moving to Mr. McDonald Obutko, Director General of the Kenya Bureau of National Statistics, where one of the implementation processes is underway. Mr. Obutko, please go ahead.
Thank you so much for the chance. I request William to help me with the presentation. Otherwise, this is McDonald George Obutko, Director General, Kenya National Bureau of Statistics, Kenya. And there's a small presentation that is to be used as a showcase to what has happened in this area of the legal identity agenda. So I'm just hoping that the presentation will come forth very fast, because we are running out of time.
Product, can you please?
Yes, I can put it for you.
Okay.
Maybe that's
I believe it's coming now.
So as that one is happening, maybe just as a follow-up to the question addressed, I still had a concern about what is being reported, because when statistics are not complete, it is likely to mislead. And I thought we would be able to have some disclaimer on such kind of statistics. Better still, we could as well maybe regionalize Africa so that we are able to see the details of what is happening. Otherwise, back to the presentation. This is the Kenyan context, and we are saying that since 2005, the government of Kenya has progressively worked towards establishing a harmonized approach to registration of persons and the identity management system in Kenya. And this is a way of bringing the two together, so the CRVS and the identification together. And so in 2019, around the month of March, April, and May, we had the what we call the National Integrated Identity Management System NIMS. And because it is it's a mouthful, we have shortened it as a Huduma number, which simply means a service number. So this Huduma number is a national program that is established to integrate the biometric population database that will be giving the single source of truth. Now, in this case, actually, what is happening, and William had alluded to this, we are bringing together all our identifications that we have, and in Kenya we have quite a number of them. We have the passport, you have the driving license, you have the national ID card, we have the national health insurance fund card, we have the national social security fund card, and voting, the political voting card. All those, a system was developed to put them together so that we are only issued with one card. And the progress is that already the first batch of this had been done. Quite a number of millions of Kenyans had been registered, and the cards are now being issued out. The second wave of the registration is underway, just to mop up the small population that was left behind. So to this end, a high-level coordination mechanism was established, with the Interministerial Coordination Committee being set up, and it was chaired by none other than the Cabinet Secretary in charge of Ministry of Interior and Coordination of National Government. Just the next slide. So that is under the process under which it was done. Next slide. Yeah, thank you. So the government has also made quite some stride in terms of strengthening the legal framework. As we were dealing with the Huduma number, it was realized that it required some legal backup, and so that was provided for by having a draft of the Huduma bill, the Huduma number bill, which was done in 2020. and also its regulations to implement it. Then there is also the enactment of the Data Protection Act 2019, which is in operation. And indeed, for this case, it has already been operationalized because the Data Commission has already been appointed. That means the office is running. Then there is also the development of the National Registration and Identity Management Policy. Again, that was also done in 2020. The next slide. Yeah, then in 2019, Kenya was also selected as a pilot country for the operationalization of the UN Legal Identity Agenda, the LEA, and it was officially endorsed in the 5th Conference of African Ministers responsible for the civil registration and vital statistics way back in 2019. That was in Lusaka. That has been mentioned by a number of presenters. And so this is what has given us the platform upon which now we are presenting on the progress made. And in December 2019, the Unect conducted a rapid assessment of the country's preparedness to implement the integration, civil registration, and vital statistics, and also the identity management system. And this is what I've just mentioned in the previous slides. The next one. Next, yeah. So what came out of it is that it was noted that the legal framework was not strong, and we needed to have that one improved. Then the integration of the system again also needed some element of coordination by various actors in the ID management. And then the other thing, to connect with the population, the advocacy and the communication was also noted as something that was in their need to be undertaken. The next one. So then the status of the implementation of the UN LEA in Kenya. In August 2020, implementation of the UN LEA through a consultative and engagement process between the Kenya government and the UN Resident Coordination Office was done. And then we have the UN through the UNDP, Unicef. They sought high-level clearance and commitment from the Ministry of Interior and the Coordination National Government to implement the LEA project. And then the same ministry in November 2020, that is last year, responded through the UN Resident Coordination Office, Coordinator's Office, and shared with the UN the government's priorities and areas of possible collaboration. So that made quite some significant progress in that. So then we have the high-level meeting between the Kenya government and the UN was also held, and a technical team constituted to discuss the the priorities and develop a work plan. Then the team identified the need for the development of an operational framework to articulate the roles of the actors in the establishment of the integrated civil registration, vital statistics, and identity management system. Then the framework is under development, and it is conceptualizing the linkages between the different systems and identifying the gaps in enabling integration. So then again, now during the COVID-19 response, like many other countries, Kenya experienced a huge data gaps to inform the true burden of the COVID-19 disease, and the government and its partners are collaborating to conduct rapid surveillance. And this is also one area we noted that as the first presentation was done, we noted that countries that do not have strong systems were reporting lower registration numbers. For example, in our case, in 2019, we reported the registration of births were 76.2%, and last year it was it dropped to 71.5%. But death was 39.1% in 2019, and this dropped to 36.1%. So it conforms to what had been said earlier some of these systems. And then resource mobilization. Actually, Kenya has benefited from a number of from this collaboration, and we thank the UN development partners and the collaborating governments for the technical and financial support. And we take note that Japan funded Kenya to a great extent. We were given 850,000 USD through UNDP Kenya. We also noted that Switzerland has also contributed 54,000 USD to the implementation of the same program as a preparatory, as seed money for the preparatory activities. And these funds are supporting the automation of the civil registration system, as already been said by the representation from Japan. And it is enabling the integration of the identity management system, facilitating the legal review process, and enabling the demand creation for registration. So your support actually has been very useful to us, and we really appreciate what has been shared with us. So basically, this is that is the end of the presentation. I know time is running out, but I thank everybody for giving me a chance and listening to this presentation. Thank you.
Thank you very much, Mr. Ditko. Thank you. Very indeed important developments in Kenya, and I believe this is something that we are also acknowledging and noting with satisfaction, and especially the contributions and the support coming from Japan and Switzerland in the case of Kenya. With this, we came to the end of the program, and then yes, we are running a bit late, but I believe that we would accommodate one or two comments or questions at this point of time. If there are urgent pressing issues, please raise your hand at this point of time to any of the four presentations that we have heard of the UN implementation in Africa pilot countries, on the cross-border mobility and legal identity, the address from the Japan, and from the presentation from Kenya. Any pressing comments? Let me reiterate that all the presentations will be uploaded today at our website, this event website, so all of you will be able to access them at your convenience and at your leisure. So with this, I would like to express again my appreciations to all the presenters, to all the participants. We did have over 60 participants at this meeting. At this side event. It was indeed very informative. We are just seeing, I believe, one of the most, I would say, comprehensive approach to a systematic solution that involves many different components of the government in a simultaneous manner, and trying to produce something that links clearly different segments that used to work alone before, like different silos. We are now developing this holistic approach, putting together these different components, and we are extremely, I would say, from the point of view from where we are looking at it, extremely encouraged by the developments that we have documented at this meeting as well. So with this, I thank you, and thank you very much. The official segment of the Statistical Commission starts Monday, but this is essentially part of it, and I wish you all the best, and have a good rest of the day or the night, depending where you are. Thank you and goodbye.
Thank you.
Thank you.
Thank you very
Bye-bye.
much. Thank you. Bye.
Thank you. Good.